All right, continuing discussion of treatments for psychological problems and psychological disorders. I talked about psychotherapy. A lot of people think of psychotherapy when they think about, what would be a treatment for a psychological problem or issue. But we also have some other stuff that can be used, and sometimes in combination with psychotherapy. And one of those you're probably very familiar with, but you might not know this special word for this is a type of biomedical therapy. Biomedical therapies are therapies that involve more conventional medical treatment that you associate with the doctor's office. And one type is drug therapy. All right, you're probably familiar with this. Some people take medication for various psychological disorders or problems or symptoms. And so we got a fancy word, psychopharmacology. Psychopharmacology is the study of how drugs affect the mind and behavior. So from psychopharmacology and research in that field, we have learned that certain types of medications can reduce some of the symptoms that are involved in some of the disorders we learned about in the psychological disorders chapter. And so my students, since this is an introductory class, I'm going to want you to just know the basics, the basic categories that are out there. All right, so one of them, antipsychotic drugs. So these are drugs that hopefully reduce psychotic symptoms. And psychotic symptoms, remember, they can show up in schizophrenia, they can show up in a manic episode, but those includes things like hallucinations, delusions, disordered thinking. And so, this general category of drugs, they're supposed to reduce psychotic symptoms. Now, I know you probably heard of antidepressants. Antidepressants are very widely used because depression is a fairly prevalent disorder compared to other psychological disorders. And also, antidepressants, they can also be used to treat anxiety symptoms too. So antidepressants, there are a variety of different antidepressants. And this reduces depression and anxiety. Antidepressants, the first ones developed, had a lot of side effects, right? But there's a newer one, and it's not all that new because I remember people talking about it like when I was in college in the 90s. But selective serotonin reuptake inhibitors, or SSRIs, you might have heard of SSRIs, it's okay if you haven't. But these fairly popular antidepressants. They're among all the antidepressants that exist, they're one of the newer ones. And one of the reasons that people like it is they have fewer side effects than some of the first antidepressants that were developed. And how do SSRIs work? Well, they've got serotonin in the name, so you might think that the neurotransmitter serotonin is important, and you would be correct. And what it does, it doesn't just make the person have more serotonin. What it does is it's a reuptake inhibitor. The thing is, when you have neuronal signaling, neurons communicating with each other, and maybe they release some serotonin as part of chemical signaling. It's okay if this intimidates you, because sometimes students at this level, they're like, whoa, that's chemistry. No, that's confusing. It's okay. Okay. So serotonin, when it's released, some of it will get reabsorbed, or it has reuptake. SSRIs prevent that reuptake. They prevent that reabsorption. So the end result is more serotonin, essentially. So it doesn't give you the serotonin directly, but it prevents that reuptake. Ultimately, the end result is more serotonin. Serotonin associated with happier, less anxious experiences. It's not a magic pill, but that's the sort of thing that people would take it for. So fewer side effects, prevents reuptake. In many people, not all, but many people, it reduces depressive symptoms and anxiety symptoms. It's meant to be used as an antidepressant, but some people do find that their anxious symptoms, anxiety symptoms go down too. I do know a few people, they have depression and anxiety. They take one medication and it's an antidepressant. Now, speaking of anxiety, there are anti-anxiety medications that are meant to specifically reduce anxiety. They're supposed to essentially calm a person down in a very oversimplified explanation. And the problem with anti-anxiety medications, sometimes they have the effect of making the person very sleepy. Some people don't like that. But just know there is a category, anti-anxiety medications. Now, the final category that I want you to know about are mood stabilizing medications. And these are typically used for people with bipolar disorder, people who have the mood instability or the mood fluctuations where you go from mania or hypomania and sometimes depression. All right. And so mood stabilizing medications are supposed to prevent those extremes in mood, and preventing someone from going into so many manic episodes or hypomanic episodes. And the first one to be developed was lithium. Lithium is kind of like the original mood stabilizing medication, and it was kind of discovered on accident. They were testing it, I believe, as a heart medication, and they just happened to notice that the people in the studies who also had bipolar disorder, that they had reduction in their symptoms, and they're like, oh, okay, let's try this out as a medication for bipolar disorder. Now, some people. And lithium is a salt, and some people don't like some of the side effects with lithium. Some people will be treated for their bipolar symptoms with medication that's actually meant to be anti-seizure medication. So anticonvulsant medication, a variety of anticonvulsant medications which were developed to reduce people's seizures who have seizure disorder. They also help with mood stabilization. They help some people with bipolar disorder. So they also can be used as mood stabilizing medication. All right, so I could tell you a lot more about psychopharmacology and drug therapy. For this introductory psych class, for my students, those are the categories that I want you to know, and just at that level that I presented them in the video.